Good morning, everybody. This is Siri Kushner from OCH, and I'm joined by Miranda Berger, and we are going to do the Change Plan Intermediary Metrics Reporting webinar for primary care partners, so welcome. Just a couple of little housekeeping things. Please feel free to ask questions if you have questions along the way. You can either do that by writing into the chat box, or you can go ahead and speak up. There's just a couple of folks on today, so this is not a huge group, so feel free to ask your questions. We are recording the webinar and we'll make the recordings available. And we are also collecting all the questions that get asked, many of which we'll be following up with on answers. We don't have all the answers today, and those will be posted and distributed so that you can review the questions that have come up and any answers or guidance that we have provided from both this webinar and the previous. This is the third webinar. Today is the last day. So we've already done this 2 times, so we've already had some questions come up. So our objectives for the webinar are to help you become more familiar with the specifications for the intermediary metrics that are relevant to the primary care change plan, and also to have a demo, a live demo of how you will be entering your intermediary metric data into the online platform, which we call ORCA. So I'm going to start with a little bit of background on our process, and then we'll move forward into the other parts of the webinar. So the intermediary metrics that were attached to your calendar invite and were distributed earlier at the end of last year were the product of the good work of our Performance Measurement and Evaluation Committee, which is a committee that was formed in the late summer of last year and very quickly got to work to help the OCH form a set of quantitative metrics that would be helpful in understanding the work of implementation of the change plan for the Medicaid Transformation Project. So these measures are intended to be intermediary or predictive measures that will help us understand the process of implementation and help our partners and help the OCH understand our work and our progress and improvements towards a set of measures which the OCH has called our 14 core measures. Many of these measures are also overlapping the set of measures referred to as the pay for performance measures that the OCH is held accountable to, and is one of the mechanisms that the OCH is able to earn funds through the Healthcare Authority under the Medicaid Transformation Project. And these core measures were the work of a group called the Funds Flow Work Group, which helped to establish the way that OCH would distribute funds out to our implementation partners. And these are really the core work within the change plan, the required elements of the change plan. And they are in 3 broad categories: integration, which is mental health and substance use disorder treatment penetration, psychiatric hospital readmissions, and emergency department visits; within access, adult and adolescent, as well as child and adolescent, as well as adult access to primary care; well-child visits for the first 15 months, as well as for children in the 3rd, 4th, 5th, and 6th years of life; and access to dental services, as well as a set of measures that are part of value-based contracting, a comprehensive diabetes care slate that has 5 measures within it, controlling high blood pressure, statin therapy for patients with cardiovascular disease, chlamydia screening among young women, and immunizations among children. So the intermediary metric set that the PMEC worked on is made up of different measures that fit into different subsets, and those are listed on the left here. And these measures are intended to drive and help us understand our work in making progress towards those core measures. And depending on the change plan type, there is a different subset of intermediary metrics, and on this webinar we'll be talking about primary care. So again, these metrics are really intended to precede or predict those core measures, many of which overlap with the pay for performance measures, which are an important way that the OCH earns funds through the Medicaid transformation work. And they're also about learning and quality improvement, a way for organizations as well as the OCH to be able to monitor and look at implementation over time. And for the OCH payment methodologies, and in particular our bonus pool, we are working on the mechanism for distribution of that bonus pool, and one element of that allocation strategy will be related to these intermediary metrics, and that work is still under development. The intermediary metrics are to be reported 2 times a year for 2 6-month periods. So they cover the period January 1st through June 30th and July 1st through December 31st. And this current reporting period your report is due on April 12th, and it will cover the period July 1st through December 31st, 2018. So there are a couple of important details related to the reporting. One is that to be consistent with the reporting that the healthcare authority is doing around measures, we are asking you to exclude duals from your reporting. And unless otherwise specified, we're asking that you report on all ages. Some of our measures or metrics are age specific, but if it is not listed that way, please report for all ages. Similarly, if there is no specification around enrollment, length of enrollment in Medicaid, we're not asking you to make any determination, just report on all Medicaid beneficiaries. And the other piece that's important here is that some of our measures are written to be similar to measures that have standard definitions through HEDIS or through NQF, the National Quality Forum. And in those cases, if your organization and your EHR are set up to report those HEDIS definitions or the NQF specific measures, you can go ahead and report using those specifications. We ask that you would be consistent over reporting periods, so that period to period you are reporting the same, using the same definitions. Otherwise, it is fine to go ahead and report based on the specifications that the OCH has written in our measures document. So what you will be reporting into ORCA is either a count, a single number, or you'll report both a numerator and a denominator that ORCA will calculate into a percent or a rate. We have 2 special codes that are used to help us understand on the back end what your reporting situation is. So if you report an 8888, this means that the measure is listed for your organization, but it is not applicable to you. It is a measure that you will never report on because it is either not work that is scoped into your change plan, or for some other reason it is not a measure that you can report on. A 9999 would be applicable when the measure does apply to your organization and your change plan work, but you do not have a system established for reporting your data yet. And I'm going to pause there for a minute and ask if there are any questions. Oops. How do we make it big? Okay. I'm going to switch to this other slide deck and now go into the specific metrics. So in the primary care change plan, there are 36 metrics, and they are split into the following categories. So there are 2 measures related to the number of beneficiaries, 6 measures related to behavioral health, 3 related to utilization management, 21 related to physical health, 3 related to dental health, and 1 social determinant of health metric. An important comment related to the primary care specific measures that we had asked you last fall about whether you are getting reports from your MCOs and your preference to report based on those MCO reports or to report based on what you can pull out of your EHRs. And this is your choice. Whatever works best for your organization is fine for us. If you have, and if you plan to use your MCO reports, we would ask that you make sure that the time periods are the same as the time period that OCH is asking for. And if you work with more than one MCO and are receiving more than one MCO report, you would need to add those numerators and denominators together, because in ORCA there's only one place to report each metric. So if you had 3 MCOs, you couldn't report it 3 times into ORCA. You would have to report it just once by combining those 3 reports into a single report. And again, as I mentioned earlier, we would ask that you be consistent across reporting periods. So if you choose to report from your EHR, be consistent with that. If you choose to report from your MCOs, be consistent with that. And always, you know, we're totally available for comments or questions related to this along the way. So let us know if you have questions. The beneficiary served is a metric that is in all of the change plan reports. So every change plan implementation partner has this reporting element. And there are 2 parts to this. The first metric is the number of unduplicated beneficiaries served during the calendar year. And for this reporting period, this would be the total for the calendar year 2018. And the second measure is the number of unduplicated Medicaid beneficiaries served during the current reporting period. So that would refer to the period July 1 through December 31st, 2018. In the behavioral health measures, there are 2 measures related to submitting claims to MCOs and 2 related to new beneficiaries. And these each have an element related to mental health and related to substance use disorders. So number of unduplicated Medicaid beneficiaries with a submitted claim for a mental health service or for a submitted claim for a substance use disorder service on the top. And in the bottom 2, this would be the number of unduplicated Medicaid beneficiaries who complete at least 1 visit for a mental health service during the reporting period who had not had a mental health service in the previous 24 months. And likewise, the bottom measure would be that same definition, but for a substance use disorder service. And these 2 on the bottom are really looking at new individuals who are newly seen for these types of services in your organization. The next measure related to behavioral health is the proportion of waivered providers within your organization. So these would be the number of providers who have a buprenorphine waiver during the current reporting period. And the denominator would be the total number of providers within your organization who are eligible to be waivered. And the measure on the bottom would be the beneficiaries who are participating in medication-assisted treatment for opioid use disorder. So the number of Medicaid beneficiaries with a diagnosis of opioid use disorder and who receive a medication-assisted treatment service during for their opioid use disorder during the current reporting period. Under utilization management, this is a metric to track high utilization of the emergency department. So this in the numerator would be the total number of unduplicated beneficiaries who had more than 5 emergency department visits for any reason during the reporting period, during that 6-month period. And the denominator would be the total number of unduplicated beneficiaries with at least 1 ED visit during the reporting period. The next 2 measures are also related to the emergency department, and we've had some questions about these, so we will be providing some clarification. These are beneficiaries with an emergency department discharge for any cause who complete a follow-up visit within 30 days of that discharge or within 7 days of that discharge. And some of the questions related to this are around the language around any cause and around follow-up. These measures were developed by the PMEC to be similar to measures that are related to follow-up for ED visits related to mental illness and for SUD, or for drug or alcohol dependence, which are very specific causes. And in this case, the any cause statement may include reasons for going to the emergency department that are appropriate. So we will be providing some additional guidance on this, on these metrics. The next three measures are in the physical health subset, and these three are related to children. These measures follow national standard specifications under the National Quality Forum. You can see the National Quality Forum number in parentheticals following the label of the metric. So the first one is for well child visits during the first 15 months of life. So this would be children who have had the appropriate number of visits in the numerator, and the denominator would be the total number of Medicaid beneficiary children in your service population who are within that age range, turning 15 months during the measurement period. The next one is well child visits during the 3rd, 4th, 5th, and 6th years of life. And this would be children who received one or more well child visits among those within the appropriate age range. And the one on the bottom is childhood immunization status. So this is children who have evidence that they've received the recommended vaccines for their age. And the denominator would include children turning 2 years of age during the measurement year. This next set of 5 measures were developed by the committee to try and understand new patients coming into a service. Part of the goal and the vision of the Medicaid transformation work within the Olympic Community of Health is about increasing access to care and increasing linkages between community service providers and clinical organizations. So this would be looking at new beneficiaries who are new to an organization by age group. The top one is ages 19 and older, so these are adults, and then there are 4 age groups for children, ages 12 to 18, 12 to 24 months, 2 to 6 years, and 7 to 11 years. And for these measures, the specification is the number of unduplicated beneficiaries by age group who complete a visit during the current reporting period and were not seen in the previous 24 months. The next 5 measures are related to visits. So one is for adults, and then 4 are for children by those same 4 age groups as on the previous page. The adult measure is adult Medicaid beneficiaries ages 19 and older who complete a visit during the reporting period. And the 4 child and adolescent measures are following the national HEDIS specifications. These are the unduplicated number of Medicaid beneficiary children completing a visit during the reporting period, and the denominator would be those covered up. Number of unduplicated beneficiaries by age group who have an assigned primary care provider within your organization. Okay, the next set of measures are related to diabetes. These are the National Quality Forum, national standardized measures related to diabetes eye care, hemoglobin A1C testing, the level of testing, whether it's in for control, blood pressure control, and medical attention for nephropathy. These, again, are based on national standard specifications, And these would be some that potentially you would be able to report from your MCO metrics or would have standardized definitions within your EHR for reporting. And the next two measures are also within the physical health area and also follow national specifications. The one on the top is the statin medication for adult cardiovascular disease measure with specific age ranges and exclusion criteria. And the next measure is chlamydia screening among women. And this would be restricted to women ages 16 to 24 years. And the measure on the bottom is one that is related to ability to access care. And this is one that the PMEC worked on, time to third next available appointment. There have been some questions about this one as well, and we'll be providing further clarification in the follow-up question and answer digest related to this measure. There are three measures related to dental. The first measure is the proportion of providers who are trained to perform an oral health screen. So this is looking at the total number of providers in your organization who have received training to perform oral health screens during a well-child visit. And this would be trained at any time, not just those trained necessarily during the reporting period. They could have been trained previously. The denominator would be the total number of providers who actually provided well-child visits during the reporting period. And the next two measures are related to claims. The first are oral exam claims specific to Medicaid beneficiaries during the current reporting period. And the next would be the number of fluoride varnish claims for beneficiaries during the current reporting period. The last measure in the primary care measure set is also one that is across all change plan types. This is the social determinants of health measure. We're interested in knowing on a scale your ability to collect and input and extract social determinants of health data from your electronic health record. So for this measure, you would report on a scale of 0 to 4. A 0 would be that you don't collect any social determinants of health data. Some examples might be housing status, employment status, transportation. A 1 would be you collect at least one type of social determinant data, but you do not enter it into your EHR. A 2 would be you collect at least one type of social determinant data. You can enter it into your EHR, but you cannot get it back out. A 3 would be that you collect at least one, you enter, and you can get one social determinant field back out. And a 4 would be that you collect, you enter, and you can extract more than one social determinant of health field from your EHR. Are there any questions? Okay, I'm going to let Miranda take you into ORCA for an overview of how you'll enter data.
Good morning, everyone. This is Miranda Berger with OCH. I'm going to walk you through ORCA and how to actually go in and complete the intermediary metrics reporting. So to begin, the step-by-step instructions for doing this were updated and attached to your calendar invite, so you have those available to you. And I'm also going to walk through it here live with you as well. So the first step is to log into your ORCA account. Most of you should already have your ORCA account set up and should be somewhat familiar as you completed your progress to date report back in December. So you log in at healthcarecommunities.org, enter your username and password, and then you will see here probably only one NCC, the one that you are operating in. So for argument's sake, if I go into Kitsap NCC, this redirects me to what we refer to as the NCC homepage. And up in the upper left-hand corner here is where you'll see a link that says Change Plan. This is where you can access your change plan and where you access the Progress to Date report. One thing that is new now, though, is there is now an additional tab that says Intermediary Metrics Reporting. And everything I'm showing you today, I am using my user account. So everything that I am showing you is what you will see when you log on to Orca. So here in the Change Plan tab is where you'll still be able to access your change plan and the Progress to Date report. That side of the online platform has stayed the same, but we will navigate to the Intermediary Metrics Reporting tab. And you can see on this gray bar here, you are able to quickly navigate back to the Change Plan tab if you need to access your change plan or your Progress to Date report. My contact information is also listed here, so if you run into any issues as you're attempting to go in and enter your data, please reach out and let me know, and I'm happy to run any sort of technical assistance to make sure that this runs as smoothly as possible. Here in the reporting drop-down menu, you'll select Enter Data. And you will only see the organization that you are assigned to. For most of you, that is just one organization. For argument's sake, I'll go here to our test organizations and pull up a primary care. And you will only see the metrics that are assigned to your organization type. So when I pull up test primary care, or if I pulled up Kids at Children's or Kids at Medical Group, for example, I would only be seeing the measures that are for primary care when I pull up those organizations. So they're already simplified for you. I already have some data that has been entered in here from our other webinars, but I'll just walk through a couple of these. The white box is where you will enter your data. The gray box after you save is where your data will auto-populate for you. So I can change a few of these and say I said I served 500 in the calendar year and 250 during the current reporting period. Those are examples of count measures where you're only entering in a single number. This next measure is an example of the percent measure where I'm entering a numerator and denominator. So I can enter just some test data here. Say I enter a 5 and 100. This chlamydia screening, say I don't think that this measure is applicable to my organization and never will be based on the scope of my change plan. I can enter then that example that Siri mentioned of 8888. And as a reference point, those instructions are also listed here at the top for you on the website. So I'm saying that's not applicable to me and never will be. And maybe the next one, childhood immunization status, is something that is applicable to me, but I am not able to report on the data at this time, and that's where I would enter the 9999. It's very important as you're entering the data to complete all of the white text fields, so nothing is left blank when you save your report, so that we know that you completed the full report. So once I've entered in all of the data, I will select either at the bottom of the page or the top of the page the blue Save Data button. It's very important that you hit that button before navigating away, because if you navigate away before hitting the Save button, the information that you input will not be saved. So then to confirm that my report was saved, I can see here that these gray boxes have been updated and auto-populated with what I input in the white boxes, and same with my percentage fields, they have been updated. My 8888 is here, and my 9999 is here to indicate that I don't believe those are applicable, and or I don't have the data available. The other way to confirm that your data was saved was if this blue text will appear at the top as well. This is data save reporting date, July 1, 2018, and the reporting date is automatic based on the beginning of the reporting period, which is July 1 of 2018. So the actual input of the reporting is as simple as that. You do have the ability to enter data, save it, and revisit this page as many times as you want to before the April 12th deadline, so it's not a one and done. You're able to do this in waves if you need more time. If you may say you're only able to get through half of the data entry and need to come back, you do have the ability to do that. You also have the ability to have more than one person access this as well. So right now, everyone who was assigned access to your change plan in ORCA also has access to this reporting, and if you need to add people, we have the ability to do that as well. The only caveat to that is that data is only visible and saved when the save button is selected. So if you had more than one user in here at a time, it is possible that they could accidentally overwrite one another's data. So we suggest if you are going to have multiple people entering the data on the platform, to have them go in one at a time or sit together so that they're not accidentally overwriting each other's data entry. Are there any questions about the ORCA side or about the metrics? You're a very quiet group today. Well, that is all that we had for you. If there are no more questions, like Siri mentioned earlier, if you do have questions about the metrics, please let us know. But we will be consolidating that question and answer digest and sending that out later this week or early next week to everyone in response to some of the questions we received on the webinars. The intermediary metrics is due April 12th in ORCA. If you run into any issues accessing ORCA or you need to add anyone from your organization to have access, please just send me an email at, so that I can be going in and adding those people for you. And if there is nothing else from those of you who joined us today, we just would like to thank you for your time and for your participation on the webinar.
Hi, this is Lucretia Stansberry from Forks Hospital, Bogus Hill Clinic. I just had one question. So the reporting is on only Medicaid beneficiaries, whether it's their primary, secondary, or tertiary insurance, correct?
I'm pausing. We will add this to our question digest. My initial response would be yes, that is correct.
Okay, because someone was telling me, no, it's only people who only have Medicaid, and I'm like, well, it says Medicaid beneficiary, so it wouldn't matter if it was their secondary insurance or not. And what would
their primary be?
Like if they have Regents or Uniform as a primary, and then have Medicaid as a secondary, or yeah, Medicaid as a secondary.
Okay, wait for the final, we'll check on this. We'll check with the state specifications on this so that we are consistent with the state on that. So please look at the question digest when it comes out. We'll have clarification on that for you. Thanks for bringing that up.
Perfect, thank you.
We learn something new on every webinar. Are there any other questions? Okay, not hearing anything. I think that we are safe to end our time, and just thank you again for joining us this morning. And thank you for your participation in the Medicaid Transformation Project, and look for that question and answer digest that will be coming to you soon. And let us know if you have any other additional questions that come up as you are working your way through this.
Thank you.